Hello, my name is Dr. Sean McCorkle at Summer Creek Animal Clinic, and today I wanted to talk to you about cat dermatology. So my assistant Lauren's going to ask some questions. I'll answer them the best I can, and I hope you learn more about cat dermatology and skin disease in cats.
Dr. McCorkle, what is cat dermatology?
Yeah, dermatology is just the study of skin diseases, particularly when we're talking about medicine. And so it's a variety of skin conditions and diseases that can affect your cat.
How do skin conditions impact the health and well-being of your cat?
Yeah, it can be pretty dramatic. I mean, the biggest thing is going to be it can cause a lot of discomfort. The main thing we see with cats and skin disease and dogs for that matter is going to be itchy. They're very, very itchy. And so you can have a cat that's just extremely itchy, where they're constantly scratching, tearing the hair out of their skin. You can also have a more low-grade itch where they're maybe occasionally scratching their ears, shaking their head. It's almost minimally noticeable, but they're still uncomfortable, which is why they're doing that. So I think the comfort and quality of life with many skin diseases can be impacted greatly. So that's the biggest thing. And then oftentimes they will develop secondary skin infections, which can worsen their discomfort and affect their quality of life. And in some cases, even make them lethargic and just kind of feeling really puny. So it can have a dramatic impact on the health and well-being of your cat.
What are some signs and symptoms of skin issues in your cat?
Yeah, the biggest one being itching, hair loss, red, irritated skin. If you look at the ears, sometimes when they have an ear infection, there will be a lot of discharge or dark gunk in the ears. And sometimes you can even see it around the outside of the ear canal. Thickening of the ear canal or of the ear flap can sometimes occur. They can have crusts and scabs and different types of skin lesions that are typical of different types of skin disease. And, the causes can be a variety of things. Certainly the most common underlying cause is going to be some sort of allergy, but also infectious diseases like ringworm, which is called feline dermatophytosis. But essentially it's ringworm. It's a fungus that cats can get, that's extremely contagious and even contagious to people. So there's that. There's mites, skin mites that can affect cats. We don't see this super commonly, but when it does occur, it can be really problematic. Some of those mites are related to the immune system being unhealthy. Others are more contagious and really, really itchy. And the most common mite we see is in younger cats, particularly ear mites. And that is a miserable condition to have. They're little mites that crawl around in the ear and bite the skin. It's incredibly uncomfortable for cats. And then, of course, skin cancers are certainly something we see in cats as well, that can have a variety of different appearances.
Why is it important to avoid self-diagnosing feline skin conditions?
So yeah, as you can see from the just variety of different things I just mentioned, it can be quite complicated with the variety of presentations and different causes. And the way that the skin lesion looks is oftentimes not a definitive, this is for sure what it causes, because they can look different ways. And so it can be really important to not try to diagnose your cat's skin condition, because a certain presentation doesn't necessarily mean a certain disease. So having a methodical approach that a veterinarian can take, looking at the signs and the history and doing some basic diagnostics is really a much more helpful way to approach feline skin disease. The other thing is, addressing the skin disease and the itching it's just can be quite complicated, and there's not very many good over-the-counter products that you can use for a lot of these situations. And some of the over-the-counter medications can be quite dangerous. So I think with cats, we just want to always err on the side of caution because they can be a little bit more sensitive. And so having your veterinarian look at your cat, assess the skin, talk about the history, do a physical exam, do some basic diagnostics, all of those things together are really helpful at trying to get a more clear picture as to what's going on.
How soon should you bring your cat to see a vet for issues with their skin?
Yeah, like with most things, the sooner the better, because again, these cats are oftentimes miserable or at least uncomfortable when they have certain skin disease, that especially if they're itchy. And so addressing that sooner is just a lot better for their quality of life, and we can intervene and hopefully get to the bottom of it sooner. There's also other conditions that can affect the skin that have a lot of other detrimental effects in the body. So just one example, hyperthyroidism, which is something we see in older cats not uncommonly, can affect the skin. So it may look like the primary issue is the skin, when in reality they have a really serious underlying medical condition. And so being able to assess and address those things earlier in the process is always better for the cat.
How will a veterinarian diagnose skin issues in your cat?
Yeah, it's a big question because there's not a necessarily a cookie cutter approach. I can walk you through kind of some of the basics that we look at. So when we have a skin disease, we've got hair loss, we've got skin lesions, whatever it may be, we've got ear problems. One of the starting point diagnostics that we will usually do is what are called skin and ear cytologies. Those are getting samples from the skin and the ears and putting them on a microscope slide, staining them and looking under the microscope. That is looking for secondary infection. So that's trying to address secondary infection that's occurred as a result of the underlying skin condition. The word secondary is really important because it's not common at all for cats or dogs to have primary skin infections. The skin infections are almost always the result of something else going on underneath, but understanding the infection is really important. So cytologies, skin scrapings, that's a slightly different technique that's looking more for mites and that kind of thing. And then, there's certain tests you can do for ringworm that are pretty different and specific. So sometimes, depending on the presentation, evaluating for ringworm is very important, and we have some really good testing for that now. We used to have to culture to find out about ringworm, which would take a few weeks. We've got some better testing now that only takes a couple days. So that's ringworm. Certain types of skin cancer require skin biopsies usually. And then addressing the underlying primary issue, particularly with allergies, is oftentimes not the simplest thing. We usually will start with a really detailed food trial. That's a very specific therapeutic diet. So you don't want to just switch your cat's diet if you think it's a food issue. We really need to do that methodically and very specifically with a certain type of food. So that's kind of a diagnostic tool because we're trying to identify if there is a food allergy. So there's steps that can be taken there that you can walk through with your veterinarian. And then ultimately, in some cats that are significantly diseased and we're kind of narrowing things down and we think there's likely an environmental allergy, we typically will refer to the board certified dermatologists for really good allergy testing to determine what the cat is allergic to. And then also then being able to create an allergy serum to directly target the allergies. So that can be really useful in those cases. And then lastly, if we think there might be a flea allergy component, which is really common, one of the diagnostic tools we have is putting them on really good flea prevention. And that will, if that helps address the issue, then that helps us to diagnose a flea allergy. So those are some of the basic things I can think of. You can see that there's quite a bit of things you have to think about, and you have to look at the history, the physical exam, all of those things to put together the best plan to proceed forward to try to get the skin issues under control.
What treatment options are typically recommended for cat dermatology issues?
Yeah, so I think I'll just break it down into categories. So if there's secondary infection, depending on whether it's bacteria and or yeast, then you have to treat those specifically with antimicrobials. Oftentimes combination of systemic medications, so either oral or injectable that get into the bloodstream, in addition to topical antimicrobials, so maybe medicated mousses or wipes or things like that can sometimes be helpful. Things like ringworm, they have to be treated very specifically with specific antifungal therapy. Allergies, so many different ways you can approach those, but treatments, if it's a food allergy, again, it's a very specific therapeutic prescription food most of the time. Environmental allergies, environmental allergies are a huge category. There's no cure for them, so it's all about management. So there's lots of different things that can be done to help manage that. The best thing being allergy testing and allergy immunotherapy. That's that serum that I was referring to. And then, the flea prevention is critical for treating a lot of allergy issues with fleas. And so those are just a few things. Again, it's a pretty broad thing to think about because it really depends on the individual situation. Supplements, omega fatty acid supplements are often really helpful for skin disease. So that should be something that's discussed with your veterinarian, with your individual cat, because there's lots of nuances to consider.
Thanks, Dr. McCorkle. And last question, are feline dermatology problems curable?
Yeah, good question. Some yes, some no. So flea allergies, absolutely. Have them on really good flea prevention year round. And if that's the only problem, then you can manage that. And essentially, you're not curing the allergy, but you're not allowing the allergy to occur. Oftentimes, the cats that have flea allergies also have other allergies. So it just gets complicated. Food allergies, again, you can't cure the food allergy, but you can manage it very effectively if we were able to identify and figure out a food that we don't react to. So that can sometimes be really, really fruitful. Again, oftentimes they'll have food allergies plus other allergies, so it gets complicated. Environmental allergies, like we talked about, you can't cure them, but again, the focus is on the best management that we can get. Depends on the severity. Sometimes these are very frustrating cases. And then other things, fungal diseases like ringworm, mites, that kind of thing can typically be cured. It's just oftentimes a frustrating process, but we usually can get cure there. And then skin cancers, that really depends on the type of cancer, how quickly it was addressed, and how aggressive it is. So you have to have a biopsy and have a pathology report to really get an idea of whether something like that is curable or not. And so I know that's a lot of information in a short time. I hope that was helpful. If you have any questions for us, we'd be glad to help at Summer Creek Animal Clinic. Our phone number is 817-523-1139. And we also have lots of great information on our website at summercreekvet.com. Thank you so much.